So I'm Foong, and I'm a consultant neurologist at the Royal Hobart Hospital and MS lead. And I'm also a postdoc researcher at the Menzies Institute of Medical Research, which is at the University of Tasmania. So multiple sclerosis, or MS, is an autoimmune demyelinating condition that affects the brain and spinal cord. So what happens is the body attacks its own myelin sheath, which is the fatty coating around the nerve fibers, and that can manifest in a variety of ways because any part of the brain and spinal cord can be damaged. So it can affect, for example, vision, and that may manifest as optic neuritis, which is just a fancy medical way of saying the nerve behind the eye is affected and inflamed, and that can manifest as pain in the eye, loss of vision. Other ways it can manifest, it can affect strength, weakness, numbness, people's bowel and bladder sensation can be affected, and their walking can be affected as well. Now, we actually have really good treatment now to prevent relapses or acute attacks of MS, but we don't actually have very good treatments at this stage of preventing slow disability accumulation in MS. And even though we have very good treatments for MS, at this stage, we do not have a cure for MS yet. So, like I said before, there's no cure for MS yet. However, we have made significant advancements in the field in the past 10, 20 years. We now have a pre-symptomatic phase of MS called radiologically isolated syndrome. And for the first time in the past 2, 3 years, we now have evidence to show that if you treat this pre-symptomatic phase, you can prevent conversion to MS. Now, that is extremely groundbreaking. And we also know that as a population who are at high risk of MS, we know that first-degree relatives of people with MS are at up to 5 to 10% chance of getting MS. And we also have a really good way of diagnosing this pre-symptomatic phase, which is MRI. So the stage is essentially set for a screening study in MS. The problem with that is that MRI costs are still prohibitive, and we really need a cheaper screening tool to try and diagnose MS at a pre-symptomatic stage to make this a cost-effective strategy. And this is where the project comes in. We now have devices called low-field MRIs, which sort of look like Dalek machines that you can wheel around the hospital or the wards, and they present a very promising low-cost alternative to a high-field traditional MRI. And we're hopeful that we can validate these devices for picking up asymptomatic MS or radiologically isolated syndrome. And this is really what the project is aiming to achieve. If we can validate low-field MRI, this really goes a long way in improving the cost effectiveness of an MS screening strategy. Like I said before, to this day, even though we're very effective treatments, we don't have a cure for MS. And what this could represent is that if we can pick up MS before it becomes symptomatic, and if we can treat it effectively, we can prevent a significant number of them from turning into symptomatic MS. As one of our consumer researchers on this project mentioned, this is the closest thing we have to a cure for MS currently. And I'm really hopeful that this represents one of the many steps that needs to be done, but a key step towards the closest thing to a cure for MS currently.